I know firsthand how very debilitating migraine attacks can be, taking you away from friends, family, work, hobbies. And the number one thing that many of us living with migraine care about is relief. What over-the-counter medications can offer any pain relief during migraine attacks?
Yeah, there are actually several over-the-counter options that are called simple analgesics. These are medications like aspirin or acetaminophen or ibuprofen or naproxen that can be helpful for a migraine attack. And sometimes these are combined with caffeine and then called combination analgesics. And that can even be more effective than the aspirin or acetaminophen or ibuprofen alone. And those things can be effective for more mild, maybe even a moderate attack. However, you do have to be careful with these medications if you're using it too frequently, meaning using it more than 1 to 2 times per week. Because number one, it can be bad for your liver, your kidney, your stomach. But also, if you're taking them too frequently and it's not actually very helpful, you can actually start causing more headaches by using an over-the-counter medication too frequently.
So over-the-counter medications don't stand up to my migraine attacks. They don't even make a dent. What types of medications that are prescriptions are available to treat migraine attacks?
Yeah, that's very common for people who have significant impairment and severity of symptoms from their migraine attacks, that over-the-counter medications are like taking Tic Tacs. Now, those are non-specific migraine medications, right? They're not designed specifically for migraine. They're really just pain relievers or reduces inflammation. There are prescription medications that are migraine specific. They were designed specifically to stop a migraine attack. The most common one that's been around for quite some time are triptan medications. There are 7 different triptan medications. Some are oral, there are some that are nasal sprays, there are even some that are injections. And especially when these medications are taken, when the pain is mild, they can be very effective for patients. Typically, they're well tolerated. However, triptan medications can reduce the size of blood vessels a little bit, so they are contraindicated in individuals who have had a prior stroke or a heart attack or have poorly controlled blood pressure. Now, there are some newer medications that actually don't have any effect on the blood vessels. GPAT medications, 2 of which are called ubrogepant or Ubrelvy, or rimegepant or Nurtec, are medications that target a protein and its receptor called CGRP. CGRP is a protein that's involved in migraine, and these medications block the receptor to reduce CGRP activity, and thereby stopping the migraine attack. These medications do not narrow blood vessels. And then there's another class of medications called the ditans. There's only one in that group called lasmiditan or Rayvow. And this medication works very similarly to the triptan medications, works on the same receptor, but it has 0 effect on the blood vessels. So it's safe to be used in patients that have had a history of a heart attack or stroke or who have a lot of other vascular risk factors. These migraine-specific acute treatment options can be more effective for those individuals that have moderate to severe attacks.
What type of other non-drug approaches or natural remedies can be used or found helpful to treat a migraine attack or the nausea that often accompanies it?
Yeah, a lot of people want to try to stay away from medications, or maybe the medication is not enough and they need something else. So it's really important to explore what are those non-drug options that can help with the pain or maybe even the nausea. Now, there are behavioral therapies, specifically biofeedback or deep controlled breathing, that can be helpful to reduce pain perception during an attack. There are also some neuromodulation devices that change the way the brain functions during an attack, trying to normalize it and stop the attack. There's currently 5 neuromodulation devices that can be used to stop an attack. And these are targeting nerves like the trigeminal nerve, the occipital nerve, the vagus nerve, as well as altering the electrical environment of brain cells with magnetic pulses. These devices include the Cephally device, the Relivion, Savvy Dual, the GammaCore device, and the Nerivio device. And these can be effective, non-drug options to stop a migraine attack. Now, some of my patients will also use things like essential oils to relieve the pain, or even ginger, which can help relieve some of the nausea associated with a migraine attack. Any of these options can be used independently if that's effective, but most of my patients will use them in addition to a migraine-specific treatment option.